Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and do a video about what happens in a CMP exam for skin cancer. So we've done a ton of videos in this series on what happens in a CMP exam, and surprisingly, they have become some of the most popular videos. I imagine it's because everybody gets nervous about going to a CMP exam, doesn't know what to expect. And so hopefully these are shedding some light on and demystifying some of that, because it shouldn't have to be so anxiety inducing. I mean, I understand that it is. I've been on both sides of the CMP exam table as a veteran and as an examiner, and I know firsthand it is just nerve-wracking. I used to tell veterans all the time that would come in to see me for CMP exams that I'm a veteran, that try to not to be nervous. I'm here to support you and do the best job that I can during this examination process. I know everybody has different experiences. Hopefully you get an experience where you feel comfortable. But beyond that, let's talk about what happens in a CMP exam for skin cancer, like I said. So let's first go over a little bit about skin cancer. I always like to do that just to talk about some of the conditions specifically. So some of those most common types of skin cancer we're going to see in VA disability are going to be melanoma, malignant melanoma, basal cell carcinoma, and then squamous cell carcinoma. So those are very common types of cancers. And the Mayo Clinic says that skin cancer is the abnormal growth of skin cells and most often develops on skin exposed to the sun. But this common form of cancer can also occur in areas of your skin not ordinarily exposed to sunlight. There are three major types of skin cancer. Like I mentioned, basal cell carcinoma, squamous cell carcinoma, and melanoma. You can reduce your risk of skin cancer by limiting or avoiding exposure to ultraviolet or UV radiation. Checking your skin for suspicious changes can help detect skin cancer at its earliest stages. Early detection of skin cancer gives you the greatest chance for success. It goes on to kind of talk about different signs and symptoms of each type of cancer. So you might want to check that out. We have another video that I've done about melanoma that might be helpful as well. So a lot of veterans are exposed to UV radiation. There are some PACT Act related things that just came out recently that discuss melanoma and the relationship to Gulf War exposures. So those are some things to definitely keep in mind. So without further ado, we're going to jump right into the CMP exam. So you should receive some type of packet in the mail that discusses where your examination is going to be, who it's going to be with, probably how long this person has been a CMP examiner, what is their profession, like is it a nurse practitioner, is it a PA, is it a physician? Like I said, all the 5 W's: who, what, where, why, when, where you got to go. So you show up to the examination, and the doctor is going to, or the PA or whoever is going to go over something called a Disability Benefit Questionnaire with you. So these documents can be found on va.gov. I love va.gov. I've said this in videos before. It's so, like, whoever did that website has done a fantastic job. There's so much informational stuff there. Anything that you can think of, whether it's to get DBQs, find out information about different disorders, MS, quitting smoking, PTSD, MST. There's a lot of really great resources on va.gov. So I challenge you guys to go and take a look at that so you can just familiarize yourself with some of the tools they have on va.gov. So if you go to va.gov and you look for disability benefit questionnaires, you can pull up the Skin Disease Disability Benefit Questionnaire. You can also bring this to your treating doctor, your dermatologist, or your private doctor and ask them to fill it out for you if they're willing to do that. It may be helpful. I always like to throw out there that I am like I said, a PA. I'm not a legal professional. I don't represent claimants in any way. I don't strategize with veterans or show them how to file claims or anything like that. That is what accredited legal professionals do, like claims agents, VSOs, and attorneys. If you are searching for one, you can head on over to va.gov, and they have a search tool that will help you find some in your local area or anywhere in the nation if you so choose to. If you just want to check someone's accreditation, there's a tool there that you can do that. And I have a video on that as well that you guys can check out. So you show up and they're going to go over this Skin Disability Benefit Questionnaire. So this DBQ is the tool that helps the adjudicators over at the VA decide What are the relevant factors and how that might apply to the ratings, whether it's service connected, all those types of details, right? So I'm going to pull up this document and present it so we can go over it together. Hang on one second. Let's see, here we go. Okay, so this is the Skin Disease Disability Benefit Questionnaire from va.gov, okay? So as you can see at the top, it's going to have information. Let me see if I can blow this up just a little bit for you guys. Okay. So name of the veteran, their social security number. Are you completing this DBQ at the request of the veteran or other? Are you a VA healthcare provider? Yes or no? Is the veteran regularly seen at your patient or in your clinic? Yes or no? Was the veteran examined in person? So this is just stuff that the doctor is going to fill out. Evidence review. So what evidence was reviewed? Did they have your claims filed? Did they have just a selection of records? This is just more administrative data that they're going to put in this block. Diagnosis. Does the veteran have a current skin condition? So keep in mind, the DBQs will oftentimes have be applicable to multiple different conditions. So this one can be used for things like dermatitis, eczema, acne, psoriasis, and also cancer, right? So we're going to just disregard some of these and go down to the cancer section, okay? So let's see, where is that block? Oh, tumors and neoplasms of the skin, including malignant melanoma. So the person's going to check this block and they're going to put your diagnosis, whether that's basal cell, squamous cell, melanoma, multiple, 2 of those, whatever you have. The ICD code is a diagnosis code, not something that you guys really need to worry about. Date of diagnosis. Okay. Then they're going to scroll on down and they're going to talk about the medical history. So describe the medical history, including the onset of the veteran's current skin condition. So they might ask you, hey, when did this happen? When did you first start noticing it? When were you diagnosed? So resolved skin conditions. Did the veteran previously have a skin condition that is now completely resolved and no longer requires treatment of any type? So maybe that applies. Maybe you had a basal cell and they cut it off. Comments, if any. So treatment. Has the veteran been treated within the past 12 months for any skin condition? Yes or no? Oh, with medications. Okay. Steroids, antihistamines. A lot of these are for some of those other conditions, like retinoids are usually used for acne, right? So these are just about medications. And has the veteran had any treatment or procedures other than systemic or topical medications in the past 12 months? So phototherapy, photochemotherapy, electron beam therapy, intensive light therapy, other treatments. And then it wants to know the duration in the past 12 months, less than 6 weeks, 6 weeks or more, but not constant, or constant / near constant. Then there's going to be a physical examination. So indicate the veteran's visible characteristic lesions due to the skin conditions and indicate the approximate total body area and approximate total exposed body area. Face, neck, hands affected on current exam. So again, here are the different diagnoses. Let's see. For each skin condition checked, give diagnosis and describe appearance and location. So these are for specific skin conditions. There's a whole section on cancer. We're going to jump down to that in a second. So these are not going to apply because we're not talking about those conditions today. These are non-cancerous conditions. Specific skin conditions. Okay, tumors and neoplasms. Does the veteran have a benign or malignant neoplasm or metastasis related to any of the diagnosis in the diagnosis section? So yes or no. So let's say it's melanoma. Is the neoplasm benign or malignant? Let's say this person has a malignant melanoma. Is it active? Did they have surgery? Like, did you have Mohs surgery? Did they cut it off? What happened? Did you have chemo, radiation, x-ray treatment, watchful waiting, other? Anticipated date of final treatment. Remission is the person, are you in remission? And it's asked, basically here it's like, are you actively having the cancer or are you in remission? And then the same questions apply. Did you have surgery and it's active cancer, or are you in remission? Date treatment was completed, or date of anticipated final treatment. Does the veteran currently have any residual conditions or complications due to the neoplasm, including metastasis, or is treatment other than those already documented in the report above? Yes or no. So maybe you have a metastasis of a malignant melanoma and it caused cancer somewhere else. Maybe you have some other kind of complication because it was on your eye. Maybe you had a melanoma on your eye and now you have a visual disturbance, right? If there are additional benign or malignant neoplasms or metastasis related to any of the diagnosis in the diagnosis section, describe using the above format. Now, scars. Scars are always the question because if whatever the condition is caused some sort of scarring, then it wants the provider to fill out a scar DBQ, which is a whole nother DBQ. And I've done a video on that, which could be really helpful. So a lot of times if you've had skin cancer, you probably do have a scar, right? Other pertinent physical findings, complications, conditions, signs, and or symptoms. So do you have any other physical findings or symptoms related that have not been already listed? Functional impact, does it affect your ability to work, right? Maybe you had a big old malignant melanoma on, one of your fingers, right? And they had to take a huge excision and now you have a difficult time typing, or maybe you have some kind of, again, a melanoma on your eye and now you're having difficulty seeing, and that applies to your job. And then there's a remarks section, examiner, certificate, and signature. So they're going to sign, put their area of practice and all that kind of information, their license number or whatever. Okay, let me jump off this share screen. So I hope this was helpful about cancer and what to expect in a CMP exam for cancer. Please drop some comments if you guys have any questions or thoughts. And as always, thank you so much for watching, and I will see you guys soon. Please like and subscribe.